Welcome to another edition of Medical Mondays. I'm Lisa Carberg. I am a medical reporter here at WTNH, sharing awesome information on lots of topics that I research and report on. We're talking physical therapy today in a really wonderful local clinic that is free, and I'd like to bring in Linda Bedard. She is a professor of physical therapy at Quinnipiac University, and you are director of the Equip Rehabilitation Program, which we are going to talk all about. Linda, before we get started, let's take a look at my recent report. I came out and saw what you were doing one evening. Sarah Hoder's parents are thrilled their daughter is able to get this high-level physical therapy.
Prior to the event, she was a normal 22-year-old girl going to school, working.
He says Sarah had a brain infection that led to brain damage.
Who are you looking at?
When their physical therapy coverage ran out, they heard about this program, Quinnipiac University's Equip Clinic, where volunteer physical therapy students and instructors give back to those who have no insurance or their coverage ran out.
She's had a lot of firsts here than, with home therapy or anything else.
We provide a really critical means for them to be able to continue their physical therapy when they wouldn't be able to receive it somewhere else.
Linda Bedard is proud of this unique clinic.
And that goes all the way down, so it's locked.
On this day, a man gets a custom-fitted piece of equipment. Students watch and learn a lot.
I love being able to see patients just completely get better before my eyes.
You really get to put together some things you learn in class and in the clinic, combine them, you get to pick their brains and really put application to the test.
Good job.
Barbara Davis of Weathersfield had a brain aneurysm and then surgery. Like others, her coverage ended, so she came here to try to walk again on her left leg.
Step.
She's witnessed tremendous progress here in others and has a great attitude.
Not use their canes, not use their crutches, not use their wheelchairs, and just actually walk out. I hope to be one of those people one of these days.
Linda Bedard is joining us with Quinnipiac University. Linda, this Equip program is amazing. You provide free physical therapy for people in the community who need it. You were the director of this program. How did it come about?
Yes, we started as a very small capstone research group in 2012, and students at that time were just really interested in opening a free clinic for the community. And so we started really small, and then every year we've grown more and more. So this year in 2025, it was our record year of being able to service around 22 clients each week and over 500 visits for the entire year. So it's been super exciting to see all the growth and all the energy around the program.
Tell me about Quinnipiac's physical therapy program. I know you guys produce some really great professionals. Tell me about your program.
Sure, thank you. Our program actually starts as undergraduates. Our undergraduate physical therapy students can either choose a traditional pathway of 4 years and then come to graduate school, or they can do an accelerated program of 3 years undergrad and then come to our graduate program. Equip Rehabilitation is part of the graduate program, of which students spend 3 years earning a doctorate of physical therapy degree. And during that time, they're able to work in the Equip Rehabilitation Clinic each week in order to gain real life experience with clients who are in great need.
And tell me, where are your graduate students from? Are they from all over the country? Your program is far and wide reaching, I know.
Yeah, it is. The majority of them are more regionally based on the East Coast, but we certainly have students from all over the place.
And tell me about, so someone made a capstone and then the Equip Clinic was born. I went over around, I think it was around 4 o'clock or 5 o'clock in the afternoon, and the public started coming in. And what amazed me is how many different types of injuries and rehabilitation were going on at the time on any given night. Tell me what happens in the clinic.
Sure. So the first thing that happens is that anybody who's in need of services can reach out to us via our website or our phone number. And all we require is a physician referral to continue to be seen by physical therapy. Then our student coordinator, patient coordinator, actually ensures that they can get into the clinic, and we set them up with a treatment team. That treatment team then gets to carry out anything that is needed from an evaluation through their entire plan of care. So we are fortunate to be able to see those with neurologic disorders, those with musculoskeletal issues, any kinds of medical complex injuries, anybody who has unfortunately had an injury. So we're not selective in the types of clients we take. If we believe that we can provide good services for them, by all means, we'll take them.
We saw a gentleman get fitted for some device on his leg. What was happening there?
Sure. So this was a gentleman that had sustained a stroke. And so with that stroke, some of the leg muscles are no longer working well. And so he was fitted with what we call an ankle foot orthosis. And it was customized very specific to him in order to be able to ensure that he can walk with a normal gait pattern. So we are really blessed that we have a local orthotist that comes to the clinic in order to teach students what their expertise is and what their lens is, and then how we as physical therapists collaborate with these other professionals. So again, that's the beauty of this program, is that the clients are getting what they need. At the same time, students are learning not only about physical therapy, but also about other disciplines and how we can work together.
I wasn't sure if he was a company rep or what he was, but it was fascinating having him explain the device to the students, how to use it, also to the patient and his loved ones as well. That was just a really great teaching moment, one of the many that we saw. And we will be talking on this show with one of your patients coming up. So I just want to tease ahead
Great.
to that because we met so many great people. What's the feedback from people who come to your clinic?
Well, we do actually survey all of our clients upon discharge and every semester that they're with us, because just like any other clinic out there in the local community, we're trying to constantly improve our quality of services. That really matters to us. So the feedback has been wonderful and overwhelming. Our students are young, mature, compassionate, and kind professionals. And so, with that, people really enjoy the opportunity to be able to work with them. They're served one on one with these groups of students, so they feel like they get good, undivided attention. And the students will always go above and beyond for them. So, the feedback has been amazing thus far, but we're always trying to make sure that we're collecting that information to ensure that we're giving quality services.
All right, Linda, when we come right back, we want to talk about how the students learn from their instructors as part of this process. We are back with Linda Bedard from Quinnipiac University. She is the director of the Equip Physical Rehabilitation Clinic that we got to visit. Linda, let's talk now about the students are there. They're able to help people. They're graduate student level students with people from the community. What they also learn from their instructors, don't they? Kind of on how to be with a patient, how to deal with them professionally. That really touched me too.
Oh, thank you. Yes, what we are trying to do is to model for them how they need to become great professionals. And part of that is professional behaviors and how we communicate with our clients and ensure that we're delivering compassionate and methodical care. So, what we have is week over week in our clinic licensed physical therapists. And those physical therapists could either be faculty members that are here at Quinnipiac or licensed therapists out in the community. Some of those are alumni who have come back to serve. All of them are volunteers. I think that's the beauty of the
And
program.
that is
So
really
everybody's really,
amazing. I'm glad you pointed that out because that is part of the beauty of this whole program is every
yeah.
person that's there that night is intense. They're working. They appear to be
Mhm.
very happy and content, and they're there on their own time.
Yes, and our individuals are coming in after a long day out in the clinic, and they're coming back in to serve clients once again, but on a volunteer level. And they are our experts guiding our students. So the students are able to deliver the care, but they're underneath the supervision of a licensed physical therapist. And week over week, those therapists change, and students then get this adaptability of learning from other professionals. So they're not all the same week after week in the clinic.
Do physical therapists specialize in certain injuries or areas, or do
Mhm.
they have to know a little about all kinds of injuries? How does that work?
Sure. Well, as graduates, physical therapists, we actually are training them to be entry level physical therapists, which mean broad strokes throughout all of the various diagnoses. So we're looking for them to be broad based. As we continue to expand as physical therapists, many therapists branch off into a specialty. So in the case here, I might have experts in the clinic each week. Some of them might be specialists in musculoskeletal kinds of injuries. Some of them might be experts in neurologic types of injuries. And so I'm always trying to create a schedule where the students, if you have a client that has a neurologic diagnosis, that I put them with an expert in a neurological specialty.
Wow.
So again, we're broad-based trained, and then many of the therapists branch out.
Let's talk about the patients. So, from what I
Mhm.
understood, these patients had physical therapy. Some of them had even been at a therapy hospital, and their order ran out. Maybe their insurance ran out, or maybe they didn't have insurance. Let's talk about
Mhm.
how the patients end up there and how they find you.
Sure. So a lot of how they land here is by word of mouth. We have a lot of alumni in the local area that are now licensed therapists, and they too have come through the ranks of the Equip Rehabilitation program. So oftentimes we will, by word of mouth, get referrals, but we also do have a website. So we are able to take anybody who needs our services. So with that, a lot by word of mouth, a lot by clinicians that know what we're about. Who can come? Anybody, you're correct, that is uninsured, so they have no insurance at all, no questions asked. All we need is a physician's script in order to be able to see them. Unfortunately, we also have clients who could benefit from more physical therapy, and we call them underinsured. So they had insurance, they've been throughout the continuum of the healthcare delivery system, maybe through an acute care hospital, maybe even a rehab hospital, home care, outpatient therapy, but they're still in need of more services. So again, they're coming back to get more benefit from physical therapy without having to pay.
And I noticed they came from all over the state.
They do. So most of them are local, but there we again have no preferential treatment for anybody. So we have some individuals who are driving up to 45 minutes to come to see us each week, knowing that they can get the services that they need.
All right, we only have just about 2 more minutes left, Linda.
Sure.
Let's talk about for anyone who might be thinking of becoming a physical therapist. It's a wonderful
Mhm.
occupation. I feel like you'll always have a job. They're always in demand. What would you say to people who might consider this path as a profession?
Yep. So, as somebody who has been in the field for 40 years, I still have an amazing passion for what I do. There's so many different avenues to go through. So, we love to be able to showcase this to middle school students, high school students coming through the ranks. They could call us, they can shadow with us. That's the greatest way to be able to see, what a physical therapist does. And again, because there's so many different specialties, there's so many avenues and ways of being able to serve others. So whether that's in an acute care hospital or whether you're somebody who would be better suited for outpatients, there's just so many settings that a physical therapist can practice in. And I think that that's the beauty of the profession. It never gets old serving others and having a passion for it.
A girlfriend of mine got a business degree. Her brother had an
Yes.
accident and was at Gaylord, and
Mhm.
she observed them helping him in the many kinds of therapies he got: speech, physical therapy, occupational.
Mhm.
And she went back and changed her career and became a speech therapist. But she saw the need and she said, I never even realized that that was something I could spend my life doing. So
Yeah.
very interesting. But yes, let's get the word out about what a great profession it is. Linda Bedard from Quinnipiac University, thank you so much for taking the time to
Thank
talk to
you.
us about your awesome Equip Rehabilitation program. Thank you, Linda.
Thank you.
We are back on Medical Mondays. I'm Lisa Carberg. We've been talking about the EQUIP Rehabilitation Program at Quinnipiac University, and now we have with us Barbara Davis. She is from Wethersfield. And Barbara, you were featured in my story earlier. You have been a rock star patient there. Tell me about your medical journey.
Okay, so in 2017, I experienced an AVM, which is a mass. It was a mass on my brain. It was completely unexpected. Didn't even know I had it. And all of a sudden, it presented itself uh, in the form of a brain bleed. And so I ended up with stroke-like symptoms, had a craniotomy, was in Hartford Hospital, and then went to Gaylord for physical therapy. And after that, ended up at EQUIP.
All right, tell me about what you like about EQUIP. I loved watching all the young people helping you and assisting you and inspiring you to take those steps. You've come back really well from your issue, but you have a problem with one leg, correct?
Yes. So I recovered from speech issues and I regained the use of my arms and hands, but my left leg is still giving me a problem in that I can't walk properly and independently without my cane. So that's what we're working on presently at physical therapy.
When you got there, were you on a cane or were you in a wheelchair or a walker?
I think I was using the wheelchair and the walker when I first went there. So there's been a lot of progress since then.
So what's it
Thankfully.
like? You go on Tuesday evenings, and
Mhm.
when you get there, is it a pleasant experience? I mean, it's a lot of work for you too, but tell me about what
Yeah,
it's like as a patient.
yeah. Well, it's a very pleasant experience because of the interactions with the students and the students. So there are multiple clients in the clinic room, but we all have our own team of students. So it can be up to 4 students um, that would be my own team, and it's a situation where they evaluate and assess and make up a treatment plan for us, and then we go forward each week with those same students, and we work on the plan. They give us home exercises. Um, we get braces, like you can see in that picture.
Yes, yes.
I've received one of those myself from that lovely gentleman there, John. And so it's just a wonderful, positive experience. The students and all the professors are extremely positive. They are working with each other to teach the students to um, hone their PT skills. And so they're doing that at the same time that the students are helping us, the clients, to do our PT. So there's a lot of learning that makes it pleasant. Um, and I was thinking about it this afternoon, and I don't think that in all the years that I've been attending the clinic that I've ever heard a negative word from anyone. They're
That's
just the most positive group.
that's
Even on my,
amazing.
yeah, even on my worst days, they are never not completely 100% positive.
And what's it like when you're in that room surrounded by your peers? They're all working with their own struggles and their own health issues to try to come back and get some normalcy in their life. But what's it like to be there?
It's it's fantastic being there. All of those people in the room have become friends.
Aw.
Their parents have become friends, the people that drive them, the husbands and wives. So all of us have become friends and maintained a friendship over the years, as well as the friendships that we've developed and maintained with the professors at Quinnipiac and the students that work with us.
What do you have to say about those Quinnipiac students and professors?
Well, it's hard to find words, seriously, because they are just such an amazing, compassionate, kind, caring group of people. They just work so hard. They're passionate about their profession. They believe in all of us. They believe that we can do better. They give us hope. They encourage us. They're just really the most wonderful group of people. There's just a fantastic culture in that clinic. It starts with Linda Bedard, and it just she's the director of Equip, and she has a lot of energy, as well as all the other professors and teachers that work with us as well.
She sure does. Yes, we just talked to her. All right, Barbara, we have about 1 minute left. Tell me what your
Okay.
goal is. Are you able to drive? What would you really like to be able to get to do? Like go to the grocery store alone or?
Yes, so my goal is to become more independent. Um, in other words, I would love to walk without my cane, which we are working on. And I have a little grandbaby and another one on the way that I'm looking forward to being more active with them. So those are my goals.
I love it. Well, Barbara Davis, thank you so much for being with me. I never know what I'm in store for when I go out to my medical shoots. And this was such an inspiring story of just seeing you and all the other patients trying and working so hard. So keep up the good work. Enjoy those
Thanks, Lisa.
grandbabies. And thank you for your
Thank you.
time. And thank you for sharing your story with us again.
Thank you. Thank you so much, Lisa. It's
Thank
been a
you.
real pleasure.
Aw.